I'm absolutely delighted to be here today, and what a lot of inspiring people we've heard from. I feel as if we're all saying similar things, and that's good, because if we're all saying the same things, we've got a better chance of actually achieving something. So, my name's Janet, forgot to take it off. I'm a consultant in sexual and reproductive health in East London. So on a day-to-day basis, I see women for contraception, abortion, sexual problems, medical gynecology, menopause, and women with problems resulting from FGM. I'm also the current president of the Faculty of Sexual and Reproductive Health Care, and we're the leading membership organisation for clinicians delivering these essential SRH services across all 4 nations of the UK. And our doctors, nurses, pharmacists, paramedics work across primary care, community services and hospitals. And I completely hear what people have been saying today about the need to educate healthcare professionals. We absolutely agree with that. We have training packages in contraception, in menopause. We've worked with a lot of people across the room to try and make that as accessible as possible. Because if we support our members, that's good for women. And as we've heard, that's then good for everybody. So, as one or two other people have, I want to talk to you today about the shocking health inequalities faced by women in our local communities, and crucially, the solutions that we need to put in place. Access to contraception, health advice is vital, but too many women just aren't able to access the services that they need, and too often they end up putting off treatment. We've heard before, this is what women do. If it's too difficult, too complicated, we put ourselves at the bottom of the list and we just don't chase it. And not getting the health care profoundly affects women's lives, not just in terms of fertility and pregnancy and family, but in every ambition, in their work, in their education, in every aspect of our lives. But unfortunately, too many women have very poor reproductive health. There's a growing unmet need for contraception. About 45% of pregnancies in Britain are unplanned or ambivalent. And you might say, well, why does that matter? But it matters because we know that the health of a woman before she conceives affects the health of her child all the way through its life. And it affects her health as well. So actually planning pregnancies is really important. But we've heard about the lack of sex education in schools. We don't talk about fertility. We don't talk about preconception care. So how are people supposed to know that if we don't tell them? As we know, women from the most deprived backgrounds are almost 3 times as likely to need an abortion than women from the wealthiest backgrounds. And access to abortion and choice in abortion is a problem. As we've heard already, maternal mortality for Black women is currently almost 4 times higher than for white women, and there are also significant disparities for women of Asian and mixed ethnicity. And we know that this is preventable and avoidable. With the right policies and practices in place, we can do something about it. So, in 2022, we launched our FSRH Hatfield Vision. We have the best colours, and there are plenty of these around. Please take one. And if all you can do is pinch the QR code off the back from somebody else's, then do that too. So the Hatfield Vision, I think, started off as a policy document. That's how it started its life. It's full of practical policies and achievable goals, but actually we don't like just talking. So what we're doing now is we have the FSRH Hatfield Vision Task Force. And I would say the fact it's called the Hatfield Vision is a tribute to the late Jane Hatfield, who some of you will know, the first CEO of the FSRH. So we now have the task force, we have implementation working groups. Quite a lot of you around the room are part of our implementation working groups, and those of you that aren't should be. And what we do in those groups is we talk together and we find solutions. So we look at what are the barriers to better reproductive health. We look at not just what do we need to ask for, but also what can we do. And when you get different people from different professions and groups around the table, you have different conversations and you realise that there are things that we can do. And the vision has been endorsed by 65 organisations. So that's a lot. That's a lot of people working together. And that includes wellbeing of women. It includes the RCOG. It includes the Royal College of Midwives, the Royal College of Nursing, Bloody Good Periods, and many more. And more are welcome. So we're also supported by NHS England, the governments of Wales, Scotland and Northern Ireland, and the Department of Health. So it is, it really is about working together to try and make something happen. So if you're here on behalf of an organisation that's not one of our endorsers, please do come and talk to me afterwards, or come and talk to Emily, who's the one that actually does all the work, and we will get you signed up. So it's ambitious, but what we're trying to do, this consensus, this strength of support, has got to turn into action. It's got to make a difference, and that's what we're here for. So to the politicians here today, you know who you are. Please work with us on our mission and let us support your parliamentary work as well. So if you get in touch with us, we can provide you with briefings on the issues that you're passionate about. We can provide you into individual constituency statistics, which you might find really helpful. And we will also shortly be reconstituting the all-party parliamentary group on SRH, and we're looking for MPs to drive our agenda forward. So join us again. So we were absolutely delighted to see strong commitments to women's health in all of the manifestos. And I'm really delighted to see you all here today, because what that means is that women's health, as we've heard, is a real priority for all of the parties. So I really hope that the support, the political support that we're seeing here today, along with the record number of women MPs in the House of Commons, although as we've heard, we're not quite 50-50 yet, means that this opportunity for real action, real change, can be a result. So thank you.